Hello everyone, a happy new year to all of you. So in today's video, I am going to discuss about the ABG questions, the basic questions. So how to we can solve them. So if you listen it once, then I think you will never forget that how we can solve it, whether it is metabolic acidosis, either it is respiratory or alkalosis, like how we can solve it. So for that we have one basic table. So for the ABG questions, our format is like first we have to check the pH level, then we have to check the partial pressure of CO2, after that we have to check the bicarbonate level, and then we have to interpret that what it is. Then we have interpretations. So for the pH, partial pressure of CO2 and bicarbonate, so first please remember that for the metabolic cases, we have to we have to see the deciding factor. Like in metabolic cases, what is the deciding factor? So for the metabolic cases, the deciding factor is bicarbonate. So the deciding factor is bicarbonate for the metabolic cases, while for the respiratory cases, there is nothing related to the bicarbonate, like we don't have to bother about bicarbonate level. So in respiratory, please don't bother about the bicarbonate level. We don't have to bother. So now let's remember this table. So if we have the signs which are similar to if pH level is also increased and bicarbonate, please for a time please forget about bicarbonate. So first we have to remember that if pH is increasing and if partial pressure of CO2 is also increasing, means here the sign is same, like if pH is increasing, CO2 is also increasing. If pH is decreasing, then CO2 is also decreasing, means the signs were the same. So if this happened, then it is the case of metabolic, when the symbols were same. So it is a metabolic case. It is a metabolic case. How we can remember? The sign of pH and sign of PCO2 were same for metabolic cases. So if the sign were same, like here as we can see, the pH level and the partial pressure of CO2 both were increasing, it means that this one is the case of metabolic. So interpretation, metabolic. In second case also, if pH is decreasing and partial pressure of CO2 is also decreasing, then also it is the case of metabolic. For the acidosis or for the alkalosis, we have to check the bicarbonate level. So for the bicarbonate level, if bicarbonate level will decrease, then it is a case of acidosis. And if it increase, then it is a case of alkalosis. So for the metabolic cases, if bicarbonate, as I already told you in starting of the video, that for the metabolic cases we have to check the bicarbonate level. If bicarbonate level will increase, then it is alkalosis. If it is decrease, then it is acidosis. The deciding factor is bicarbonate in the case of metabolic level. Now for one also important thing, that we have to remember these correct value, like what is the pH value, normal pH value. So for the normal pH value is 7.35 to 7.45. so this is the normal pH value, and the normal partial pressure of CO2 is between 35 to 45. This is the normal partial pressure of CO2, and the bicarbonate value normal is 22 to 26. So these were the normal values: pH normal value, partial pressure of CO2 normal value, and bicarbonate normal value. So in this way we can decide whether it is metabolic or acidosis or alkalosis. Suppose here I will give you one question, like if the pH is 7.30 and the CO2 level is 30, then and also the bicarbonate level is, suppose here is 20. So here we can see the pH level is decreased. Partial pressure of CO2 is also decreased, because normal is 35 to 45 and normal pH is 7.35 to 7.45. So though both the values will decrease, pH and CO2 both values are decreasing here. It means that it is a case of metabolic. And after metabolic, we know in metabolic cases we have to check the bicarbonate level. So here the bicarbonate level is also decreasing, which is almost between 22 to 26. So here as it is decreasing, it means that here the bicarbonate level is decreasing and it is a case of acidosis. So in this way we can check that the ABG analysis of this case is metabolic acidosis. Metabolic acidosis. So this one is the first example. Now after this we also have to check whether it is respiratory alkalosis or for respiratory acidosis. For that also we have to remember that if both the value pH and partial pressure of CO2 values are not equal, like if pH is decreasing then CO2 is increasing, like these values should not be equal, like both are not decreasing at the same time. If they decrease at the same time then it is a case of metabolic. But if they are unequal, suppose here pH value is increasing and the partial pressure of CO2 is decreasing, then it is a case of respiratory. So here it is a case of respiratory. Now for the respiratory case we don't have to bother about the CO2 value, whether it is increase or whether it is decrease. We really don't care about in the respiratory cases. So as the values are not equal, pH value and CO2 value is not equal, it means that it is a case of respiratory. Now the other thing what we have to check here the level of pH, like whether the pH level is here decreasing or increasing. So here in this case pH level is increasing, it means it is more than 7.45, and as we know if the pH value is more than 7.45 then it is a case of alkalosis. So here it is a case of respiratory alkalosis. Now the second one, just I have to little bit shift it down. Okay, now the second one is like if the pH value is decreasing, like it is less than 7.35, suppose it is 7.30 again, and the partial pressure of CO2 is increasing, means here both one thing is decreasing and the other thing is increasing, it means they are not equal. It means that it is a case of respiratory, and in respiratory cases we don't have to think about the bicarbonate level. So here we don't have to think about bicarbonate level, whether it is increasing or it is decreasing. Now again check the pH level. So here pH is decreasing, means it is less than 7.35. If pH is less than 7.35, it means that it is a case of acidosis. So here we can say that it is a case of respiratory acidosis. So in this way we can find that whether it is respiratory acidosis, respiratory alkalosis, metabolic acidosis or metabolic alkalosis. So for now I will give you one question. Please solve it and answer in the comment section. So here pH is suppose 7.30 and the partial pressure of CO2 is, suppose here it is 30, then bicarbonate level is, suppose it is 20. So now please check what is it, whether it is respiratory or metabolic case, whether it is acidosis or alkalosis. So that's all for this video. I hope you guys enjoy it. Thank you. Bye bye guys.